So first of all, there's no mobile phone signals in the majority of our hospitals. We've got 4 acute hospitals in ABM, so even at the basic level, people weren't able to make phone calls or access internet sites on smartphones. Secondly, we found that patients, we had a lot of letters from patients requesting us to provide access to things that they take for granted, like internet services. And thirdly, we're promoting bring your own device within the health board, so clinicians have access to email, calendar services and internet access on their phones. Without a mobile phone signal, they simply can't have access to those services. And the reality is Wi-Fi has become part of everyday life. When people come into hospitals and don't have it, it causes major problems. Firstly, we needed a reputable company to work with. We needed a company that could provide us with the necessary services for us to comply with legislation in providing that public Wi-Fi. And by that I mean user authentication and content filtering. And the content filtering, we were very clear, needed to be family-friendly filtering because it needed to be appropriate for children as well as adults. And the service needed to be free for all. So we didn't want to be putting a service in that was free for certain users or staff because of their mobile phone contract or broadband contract. It had to be free for all. And tied into that, having a service that is free for the end users, there's a cost to the organisation which needed to represent value for money. So initially, when we switched on the service, we had thousands of people connecting to the service, so we know there's a demand there for using this service. We've had extremely good feedback from patients and staff, in particularly dialysis patients who spend hours on end being treated and are cut out from the outside world. Now they're able to keep in contact with family, surf the internet, and do things that we take for granted in the home. So it's making a big difference. Another example would be a lady that was being treated for a fracture, broken ankle. She couldn't get access on her mobile phone, so she used social media. She used Facebook to be able to connect to family and get her children picked up from school. So these are some practical examples that we've seen. It's also allowing our clinical staff to have access to important information like NICE guidelines at the point of care. Previously, they'd have had to leave the patient, go and find out information and then come back. So clearly there's huge benefits of being able to have the wireless to be able to do that. And in the future, we'll be looking to get patient feedback. So that's something that we can add on the back of the public Wi-Fi service to get feedback from patients using the hospitals and services to make sure that we're providing effective services.